The landscape of healthcare is constantly changing and evolving with different political landscapes, but the one constant is the needs of our population, and hence me having been part of the board for a number of years has allowed that level of continuity to prevail as we work together to improve the quality of the estate within the city. It's really important that the CCG has a fundamental role in understanding the use of all of its assets, including the workforce, but obviously in this context the estate that we commission services from. It's a huge part of our expenditure profile is the estate, and therefore to make sure we're making best use of that, it's vital to connect up the different services to ensure that we get the most efficient use of buildings. But I'm particularly passionate about making sure that we break down the organisational boundaries between the different parts of the service, both across health and local authorities. And I think what I'm seeing and the work that we've been pushing forward with Citycare is how we ensure that the estates doesn't have organisational boundaries, and we enable the space to be used for the benefit of our patients and population. The approach that's undertaken within Citycare means that we, whilst we're coming from different perspectives, we get a much richer and more holistic view as a result of us all coming from a different viewpoint, and hopefully for the benefit of all partners. Having had the benefit of looking elsewhere across the country, I think it's become quite clear that we are unique as a Citycare board in terms of being able to push on and take calculated risks that genuinely are the right thing for all parties. I think most recently we've had a huge challenge working through the West Hull Hub financial close, many twists and turns on a scheme that could have genuinely sort of gone one of two ways, and I think it was absolutely the dedication, the commitment, and a genuine desire to get through any of the barriers wherever we could, and I think that's resulted in us getting a financial close in a part of the city that for a long time has been very much under invested in. Looking to the future, the long-term plan, which is all about how services are integrated and we break down organisational boundary. I think the work that Citycare has done in the last number of years, certainly in the time I've been a board member, is going to be fundamental to us being able to consolidate and further push on with that agenda.